Good afternoon and welcome to our briefing. Well, we've made it through another week and I want to thank everyone for really hanging in there. Today we're going to provide some news about more openings. Then Supervisor Fletcher will have a presentation on a new website that we have deployed in partnership with 211 San Diego that will make it easier for people to schedule appointments for tests. We're pleased to be joined today by Bill York and Meg Storer, both with 211 San Diego, and we thank them for their work on this new website and this new opportunity. Finally, we will close out with an update on our numbers before we go to questions and answer. Over the last few weeks, we've seen our county slowly begin to transition into a reopening of businesses and civic activities. It hasn't been as fast as some would like, I would acknowledge. Certainly I've gotten letters and phone calls and emails about opening up other businesses and activities. Well, late last night, we received word from the state on new guidelines for additional business activities that will be allowed to open starting next Friday on Friday, June 9th. And waxing, nail salons, tattoo parlors and piercing salons, and massage therapy in a non-healthcare setting. As with all the businesses that have reopened, there will be restrictions and there will be steps that they will have to take to operate safely. I urge all the business owners to visit the Safe Reopening page on our coronavirus website to learn more and to fill out a safe reopening plan that they will be required to post before they open. We know some of you have been asking for these businesses to reopen, and you are no doubt eager to visit your favorite establishments. But I want to offer two notes of caution. As we have said when announcing previous openings, the fact that these businesses can reopen next week doesn't mean that they will. Some businesses may need more time to prepare for their opening, so please check before leaving home. And most importantly, the fact that these businesses may reopen next week doesn't mean the crisis is over and we can relax. Coronavirus is still out there in the community, and as you will see by the continuing number of cases, it's a problem that we still have to deal with. In several states throughout the nation, reopenings have led to increases in cases. We don't want that to happen here in San Diego. So please, continue to wear a facial covering when you're headed out. Please wash your hands or use hand sanitizer after you visit a business, and please avoid touching your face. We can't let reopenings lead to a surge in cases that will ruin all the good work that we've all done together over these last few months. We don't want to move forward only to have to fall back again. So thank you for your help and cooperation. With that, we'll go to Supervisor Fletcher.
Thank you, and good afternoon. We continue to see a very rapid pace of reopening in San Diego County with businesses and leisure activities around our county continuing to reopen. And we see these reopenings at the same time. We watch very significant spikes in cases in other states and jurisdictions that started their reopening process ahead of us. This is hopefully a strong reminder of the need to be vigilant, the need to take the actions necessary to do everything we can to avoid the surge that we are seeing not only in other states but in other counties here within California. We certainly hope that our efforts around testing and tracing in particular allow us to more rapidly identify positive cases and isolate them and contact trace their close contacts to determine if they might be positive as well. But the testing and tracing component only serves a partial purpose in slowing the spread. The other way that we work to slow the spread are the actions that we've asked San Diegans to take. We, as a county, do have a mandatory face covering anytime you're within 6 feet of a non-household member, and there is growing evidence that suggests that these are effective in slowing the rates of transmission. And we urge the public to please, as best you can, adhere to those orders, along with the things like hand washing, physical distancing, and temperature checks. It is the hope that Those 4 actions combined with the testing, tracing, and treatment put us in a position where we can manage and contain the spread of coronavirus in a way that protects the integrity of a healthcare system, protects our lives, but also protects our ability to continue with an economic reopening. As we've talked about multiple times, we have 13 triggers that we measure on a daily basis that guide us in terms of the ability to continue to reopen and also guide us at what point we need to take some action to address an increase in cases. There are 3 of these triggers in particular that are an immediate red flag if triggered by themselves would cause us to take action. And I just want to spend a moment talking about one of these triggers, which is community outbreaks. Community outbreaks are an outbreak in a setting that is outside of a congregate care setting, outside of a hospital, a nursing home, a skilled nursing center. Community outbreaks are locations that are truly in the community. On Wednesday, we had 3 community outbreaks, new community outbreaks in the preceding 7 days. Today, we have 2 more outbreaks. That brings us to a total of 5 new outbreaks in the preceding 7 days. These outbreaks have been at a restaurant, in an office building. We have previously seen them in churches, individuals' homes, parties, unauthorized weddings. These are the types of scenarios and settings in which we are seeing outbreaks. And again, the triggering would be 7 new community outbreak settings in a 7-day period. And so we will continue to monitor these as we go forward. But it is a reminder that each of these occurred in settings where individuals congregate together, generally indoors. And so we continue to urge caution when non-household members are congregating together indoors, that the danger of coronavirus remains and its ability to spread continues to be present. And so we ask and hope that we have continued widespread adherence, which would hopefully continue keeping San Diego in a positive position and positive place to continue during our reopening. Another part of our efforts surrounding the reopening are certainly efforts surrounding testing. And we want to see an increase in our testing, which we are working tirelessly through our T3 strategy, test, trace, and treat. I want to commend the County Health and Human Services team and our T3 strategy led by our Director of Health and Human Services, Nick Machione, who have spearheaded the strategy to really try and ramp and increase our daily testing capacity, which gives us a better surveillance into the community and a better ability to rapidly identify positives. And then the tracing component is vitally important, where we identify the close contacts of those individuals and we can test them, which we believe helps us stop the spread. But one portion of this that's important is that we do have continued testing in terms of people signing up to get tested. We do have a lot of testing capacity, and we want to match that and mirror that with individuals seeking to get tested. And so today we're announcing a new website, an interactive website that we think will make it much easier for San Diego County residents to get a free test. And again, the testings that are available through this website are free of charge. They're available to anyone in San Diego County who has a desire to get tested, and we have testing sites located throughout San Diego County. And so I'm going to briefly walk you through this new sign-up tool and point you where to go. So if you go to 211sandiego.org, I just did it on my phone before we came out. We tested it yesterday. If you go to 211sandiego.org, you will see this page that will show up on their homepage. If you click on free COVID testing available, the really big one right there, really hard to miss, then it will take you to the next page. It will take you to this site right here, and this site gives you a couple options to look for testing locations and testing schedules. This is where you can find the testing location that is closest to you. So if you click on testing locations, it will take you to this, and you can either enter your address, or if you allow location services, it will pull up all of the testing locations and identify the one closest to you. You look at the one that you want so we'll go to the next one here. This is a sample. If you lived in the 91950 area, this would show you a number of the ones that are close to you. And then when you see this, you can identify the one. You can see the times that they're available based on the days they're available. If that is a date and time and location that's convenient for you, then you would actually click on that location, which would allow you the opportunity to say schedule testing. That would then pull up this, where you would begin to enter your information. Again, testing is available to everyone who is over the age of 12. If you are under the age of 12, you will be directed to Rady Children's Hospital to make contact with them, and they are handling our pediatric testing. But we'll get a little bit of information for you. We will confirm your information and schedule you for a test. These are for the ones we do through the county. Some locations are run by the state, and if you click on a state testing site, then this is what it will look like when you come from there. You will very similarly follow the steps, enter your information, and you will be confirmed for a test. So again, we are encouraging folks to go to 211sandiego.org, utilize the features that are there to arrange to get a test. And again, these tests are available to anyone in San Diego County. There is no cost, there is no charge, and we encourage folks to go get tested. With that, let's jump into our daily reports and charts. Speaking of testing today, a pretty significant number. Again, as we have seen, this is, we think, represents batching of several days of tests, which takes us to a single highest day total. Most of our single highest day totals have been days where we thought it included batching, but again, we are progressing forward, and you can see that 7-day average at 4,662. Again, this is the number we really want to get over 5,000, but we continue to move forward. Contact tracers continue to advance, 440 contact tracers on board. You can see we're well in excess of 200,000 tests, over 11,000 investigations performed, and then our treatment rooms available for folks who can't isolate, you see there. Going to the next chart, you will see today we are reporting 132, I believe, 132 out of the total of over 6,000 for a 2% percentage of positive. And again, what's important here is that 14-day rolling average you see there holding very steady and flat across there. Going to the next chart, you will see very minor changes holding relatively stable from yesterday. Down a little bit on ICU, down just a handful on 9 ICU. Again, these are COVID-related hospitalizations in our area's hospital system. We go to the next chart and we can see this 352 COVID along with the non-COVID for a total of 4,032. Again, with that 80% cutoff or trigger right there at 4,863. Next, we'll look at the ICU utilization for today. Again, you see the COVID-related ICUs down just a little bit, non-COVID ICUs up just a little bit, which brings us to a total of 69% of our ICU beds are presently occupied. Again, our triggering number is 80%, so we are up a little bit, down a little bit over the preceding weeks, but that is where we are today. With that, that concludes my report. I'll now turn it over to Dr. Wilma Wooten for a Public Health Officer's report.
Welcome everyone to today's briefing, and thank you so much, Supervisor Fletcher. Today's COVID-19 update for global, national, and statewide statistics is based on data from the Johns Hopkins dashboard and was obtained at approximately noon today. Globally, there are almost 7.6 million positive cases, including over 423,000 deaths. Nationwide, the United States is reporting over 2 million positive cases, which represents 27% of the global number and includes over 114,000 deaths. Statewide, California is reporting almost 144,000 positive cases, which is approximately 2% of the global number, and includes 4,940 deaths. And today, the County of San Diego is reporting 9,130 cases, which is 132 more cases than we reported yesterday. And this includes 313 deaths, which is 6 new deaths reported since yesterday. Since yesterday, 1 death was recently reclassified as no longer a COVID-19 related death. The age range for all of the cases remains the same, 3 months to 102 years of age. 53% of the total number of cases are between the ages of 20 and 49 years of age. 41% of all of the cases are female. 51%, of all of the cases are female. 49% are male. In this slide, it shows a summary of the cases since the beginning of the pandemic. Please show the next slide. And with weekly number of cases on the left and the number of daily cases for the past 14 days on the right side. So you'll see here the number of cases for each day. We've had 1,489, or 16% of all cases, have been hospitalized, and 421 of the total number of cases have been admitted to the ICU. This number is 5% of the total number of cases and 28% of the total number of individuals hospitalized. Now, in this next slide, it shows a similar format as you saw for cases with this is an average of the weekly number of cases for hospitalization on the right, and then for the past 14 days, the number of hospitalizations reported on a daily basis. And going to the next slide, this is our summary of all of our deaths. We have, as stated, 313 deaths, which represent 3% of the total number of cases. And of the 6 new deaths reported since yesterday, the dates of these deaths occurred between May 3rd and June 10th, and the age range is 69 to 101 years of age. And of the total number of deaths, 42 are female, 58 are male, and 298, or 95% of the total death cases, had underlying medical conditions. 14 or 5% did not. And 1 is pending confirmation regarding underlying medical conditions. Regarding race and ethnicity for all deaths, we have data for 99, or 309 of the 313 total, which means we do not have race ethnicity date for 4. Of this total, that for which we do have data, 133, or 43%, are Hispanic or Latino. 130, or 42%, are white. 36 or 12% are Asian, 9 or 3% are Black or African American, and 1 or 0.3% is Native Hawaiian or Pacific Islander. And our sincerest sympathies and condolences go out to the family and friends of those individuals reported today who have lost their lives to COVID-19. In the next slide, this provides our epi curve, and this is weekly cases by onset of illness. And as we can see, most of our cases have occurred primarily between April 20th and May 8th, but in the latter part of May, we can see increased numbers similar to the early part of May. And in the last 14 days, that's the incubation period, so we would anticipate that we would see more or new cases there. And as we reopen, the number of cases for that period could actually go beyond the first wave, if you will. So that's why it's very imperative that individuals adhere to the strategies that have been outlined so that we can keep our numbers down. And also, since the beginning of the COVID-19 pandemic in San Diego County, we have had a total of 104 outbreaks in congregate settings and community settings. Of the 104 outbreaks, 48 or 46% are now identified as closed or inactive outbreaks, meaning there have been no new cases in the last 14 days or longer. Of the 104 outbreaks, 56 or 54% are still active. And focusing on these 56 active outbreaks, 20 of these are in skilled nursing facilities, 23 are in non-skilled nursing facilities, and 13 are active outbreaks in community setting locations. And Supervisor Fletcher described those are anywhere outside of congregate living facilities. So it is very imperative, again, and I cannot stress it enough, that as we are reopening, it is really important for people to adhere to the social distancing strategies, wearing facial coverings, hygiene and sanitation, as well as for businesses, schools, and other locations as determined by the guidance from the California Department of Public Health, to conduct screenings, which would include temperature as well as symptom screenings where appropriate. So the county is also actively assessing the triggers as we reopen for modifying our health officers' orders. And as we begin to open up, this will be even more important. So these are the 13 triggers, and all are green, which is good. But again, we cannot become complacent. Neither monitoring here at the county or you and the public adhering to the strategies that have been outlined to help prevent spread. So this is good news, but again, we can't rest on our laurels. And there are 3 triggers here that are, any one of these triggers really will kind of ring the bell, if you will, for us to dig deeper and look at what's going on. But there are 3, number 2, number 7, and number 9, that are of significant concern. And then if any one or more in 2 of the 3 columns are also abnormal, that also will be of significant concern for us. This document is updated when we present this to you at our pressers each week. So as more businesses and other industries reopen, and more activities increase, the county must continue to be vigilant and utilize all of the strategies available to us to decrease the spread of COVID-19. I want to personally thank all of those individuals and businesses that have helped to flatten the curve, and San Diego continues to be a model both throughout the state and nationwide. However, it is obvious via national news that other regions are seeing COVID-19 cases increase because they have opened up. So we do not want that to happen in San Diego. Whether you think so or not, every one of us has a role and can take action to make a difference in curbing COVID-19. So we are continuing to count on you to help us with this process. Now please welcome back to the podium Supervisor and Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. Before we go to the questions, I just want to make one clarification. As I mentioned at the beginning of this media briefing, the following businesses will be allowed to open next Friday on June 19th, and they include personal care such as electrolysis and waxing, nail salons, tattoo parlors and piercing shops, and massage therapy in a non-healthcare setting. The guidelines have not been released by the state yet, but we expect them to be released shortly, and so we would encourage people to go to our coronavirus-sd.com website. Under Safe Reopening, you can check to see when those guidelines are posted. With that, we'll go right to the questions.
Artie Ojeda with NBC7, please ask your question.
Good afternoon, everybody. Supervisor Fletcher just talked about 5 community outbreaks in the last 7 days. I want to follow up on that. It's been about 2 weeks now since restaurants reopened, and also we've had these protests on the streets. Have there been any confirmed positives or COVID outbreaks associated with either reopened restaurants or the protests yet?
Okay, I'm going to ask Dr. Wilton to go ahead and respond to that.
Thank you, Artie. To date, we have not had any restaurants. As of yesterday, we hadn't had any restaurants, but we did report one restaurant this morning, which is our first restaurant that is associated with an outbreak. And in terms of specifically associated with being infected at the protests, not aware of any cases where individuals were infected at the protest, but we are aware of some individuals that may have attended the protest and was confirmed. So I'll just say that.
Okay. Can you be any more specific? Can you give us a location, the specific restaurant? Can you tell us which protest these cases happened at? And I know the county has been consistent about not giving that kind of information because of privacy concerns, but don't you think that this is a matter of public interest and public health concern?
Well, I certainly think that people are interested, but in cases where the public would potentially have been exposed, that has been taken care of with the one case that we are aware of in terms of an individual. With the restaurant, we again are not going to divulge that, Artie, because of first of all, that case is under investigation. If we need to issue a press release to let people know about the outbreaks, we will do that. But at this time, we are still under, that particular case is still under investigation and was just reported today.
Are you still there?
Not any longer. Did you have another question, Artie? Okay, let's go on to the next call.
Rebecca Soon with Cal Matters. Please state your question.
Hi. So I'm wondering about the tourist attractions and things like hotels in San Diego County. So considering there are so many different tourist attractions and that are opening up again, along with hotels and campgrounds and RV parks in San Diego County, are you concerned about the influx of tourists spreading the coronavirus, and what steps are you taking to prevent that from happening?
Okay, Dr. Wooten will respond.
Thank you for the question. Of course, we are always concerned, as stated in my comments, with reopening of businesses, activities, and many other industries. We expect that there will be increased number of cases. So we are definitely concerned about the number of cases increasing as a result of businesses, activities, and other industries opening up. And the way we try to identify where these are is that we have if a case is positive, we have staff that interview the case to find out who their close contacts are. Now, up until many of the businesses and industries opened up, about 2 to 2.5 close contacts are family relatives. But as things open up, it could be people, close contacts could be someone that an individual may know more casually than a family member or a household member. But we just have to wait and see as to what happens, and we will respond to these cases as we normally would do with investigating any particular infectious disease. And if we need to, and as many of you are aware, and with some other past communicable diseases, if we cannot identify who all were exposed, then we would rely on a news story or press release to get the word out, so that if an individual was exposed and we did not know it, then they could be made aware through a press release.
Mm-hmm. And I'm wondering if there were a lot of cases associated with tourism, how the county would respond.
We would respond to tourists in the same way we always respond to communicable disease. Where an individual lives or resides, that's where a particular case is allocated. So we would work with the state and the federal government, i.e. Centers for Disease Control, particularly if an individual utilize air travel. So we would work with both CDC and the state so that they could identify state-to-state jurisdictions, and then the state jurisdiction would notify a local jurisdiction as well, if those individuals were outside of San Diego.
Mm-hmm. Yeah, and would you consider making restrictions tighter again on businesses?
That's the focus for our triggers, is that if our triggers go awry, The purpose for having the triggers is that if they do go awry, then we would have to dial back down and implement some of the strategies that we are loosening up on. And I know that no one wants to do that. That's why we are asking people to be cooperative with the strategies that have been outlined for the public.
Thank
Okay,
you.
we'll go to the next question.
Paul Sisson with the San Diego Union Tribune.
Hi, I wanted to, sorry about that. I wondered if I could just ask a little more about the 5 community outbreaks occurring in the past 5 days. As you said, if we get to 7, then you have to look at dialing back some of the activities and businesses that have recently reopened. I wonder if we had 2 more tomorrow, would we hit 7, or would a couple of those drop out? I guess I'm trying to figure out kind of what would have to happen in order to hit that unlucky number 7 sometime soon.
Dr. Wooden's going to respond.
Paul, we have to have a target. So we looked at, we chose 7 because at the time when we chose the triggers, we actually only had about 3 during the month of May. And we are still aggressive in investigating any of the community outbreaks. Right now, we have about 15 cumulative that are active. And this is a rolling 7 days. So in the past 7 days, we have had 4. Tomorrow, the day that's furthest away, if there was an outbreak there, that would drop out. So again, it's a rolling 7-day number of outbreaks.
Right. I get all that. I guess what I'm asking is, if we have 2 tomorrow, is everything getting shut down again, or is one going to drop off tomorrow so you won't hit 7? Yeah.
I thought I'm sorry, I wasn't clear. Today, the furthest day away, if there was an outbreak there, that would drop off, and we would not reach the 7 number. But again, it's a rolling 7 days, and it doesn't stop what we do. We still are aggressive about the investigations, but we would have to put something out in terms of trying to encourage the community to be more vigilant. The outbreaks are important because if there are outbreaks, it's not any given outbreak, but we have the total number of 7, but we're really focused on if there of that 7 are many of them in restaurants, or are many of them in businesses. So it just depends, and there is no one-size-fits-all. It will be case by case. But we would...
As you look at the facts...
Pardon?
Sorry. As you look at the facts in the 15 community outbreaks that you've seen so far, what are some of the common exposure routes that people should be most concerned about? What would your message be to them in terms of, guys, watch out for this and this and this?
The same thing that we talk about every day. Some of the outbreaks have been in individuals' homes, in residence, backyard barbecues, or dinner parties, and none of which, these occurred last month, and none of which should have occurred. So what we're asking people is not, even though they might think that things are safe, this virus is circulating throughout the community, and for the cases that we showed, today we had 132 new cases. So we're asking people to still be vigilant, even as things open up.
Thank you.
Thank you.
Dr. Wooten, actually, Taryn Mento from KBBS has a similar question related to the outbreaks. She, first of all, was asking for clarification. Has it been 4 or 5 outbreaks? And is there a way she can get specific dates on those when they were reported?
So we can show the triggers again. Through 11:59 yesterday, we have a total of 4 outbreaks, community outbreaks. We certainly have had other congregate care facility and non-congregate or non-SNF facilities, but the trigger is focused on community outbreaks. And this information is posted will be posted on our website by 5 p.m. today.
And as far as the dates, the specific
I don't know the
days?
dates,
Okay.
but it's been in the last 7 days. So it has been over the last 7 days.
Okay.
Yeah.
And this question is from Michael Hart with Julian News. Can music be presented in restaurants and bars, especially patio-type establishments?
If you review the guidance from the state, they are recommending that there be no live music in restaurants and bars. Certainly, you could probably have music piped over. But the thing is that if you play music, it encourages people to get up and start dancing, and we want people not to do that.
Well, that concludes our media questions for today. As you saw, it's now easier than ever to get a test. We continue to add testing sites, and I want to mention a new testing location, which is going to be opening up very shortly. For those seeking a no-appointment, same-day test in South County, the county is partnering with South Bay Urgent Care, which is located at 1628 Palm Avenue, to offer testing. Located in the city of San Diego near its border with the city of Imperial Beach, the clinic is offering drive-by testing Monday through Friday from 9 a.m. to 8 p.m. and on Saturday and Sunday from 10 a.m. to 6 p.m. While tests are typically covered by insurance, the county is supplying and testing up to 20 tests per day to cover the uninsured. I certainly urge you to visit them and get tested. We will not be holding a media briefing this weekend, but our communications office will send out updates. For ongoing updates and information, please visit our coronavirus website at coronavirus-sd.com. So we'll see you again on Monday. Until then, stay safe, San Diego. Thank you.